We're going to demonstrate PO medications. First thing I'm going to do is state the 6 rights of medication, and that is the right medication, the right dosage, the right route, the right patient, the right time, and the right documentation. Now, the high alert medications are antihypertensives, anticoagulants, antiarrhythmics, and insulin. Anytime you use those high alert medications, you're going to have another nurse verify your calculation. We're going to have them to verify how many or how much of the medicine we're actually giving. We'll also have to check the patient's apical pulse for 60 seconds. We're going to do, if it's below 60, we're going to withhold the medication and notify the provider of their situation. But we will not give high alert medications if the heart rate is under 60. That is our 4 high alert medications. Now we're going to, if any time before we go get any medication, we're going to check our orders and we're going to perform hand hygiene. Then we're going to gather our supplies. We're going to get the medication that we need out of the drawer, and we're going to compare it to the MAR to check, make sure this is the right kind of medicine. We are going to put it in the correct space, and so the instructor can come by and check it. We're going to make sure it's unopened so the instructor can check it before we do anything with it. We're also going to show each types of medication we'd be given, like as far as crushing, cutting, and actually administering liquid medication. So first, if we have medicine in a bottle, we're going to use our dominant hand to open the medication, and we're going to shake the bottle until we get our medication out that we need. If I can get it. There we go. And then we're going to pour it in our cup. And then we would take that to the patient. If we, had two tablets in there and we only wanted to give one, we would put that one in here. We would take the other one and put it back in the cup, like that. If I don't have a crusher, but if we were to crush medications, you always wipe it down with an alcohol swab, and we would clean it, make sure it's clean, and we would put the tablet in a small bag and crush it and put it in applesauce or whatever the doctor has ordered us to do with it. Make sure it's about a spoonful. We're always going to assess the patient's ability to swallow medications as well, especially with tablets here. And if they're not, we would crush them. We can only cut scored tablets. That's the only kind you can use the actual pill cutter for, scored tablets. I don't have that either, so we're not going to do that. But when it comes to pouring medications, that's our scenario today. So I'll demonstrate that with the scenario. So our scenario is order is 150 milligrams PO PRN. Our medicine we're giving is guaifenesin. It's a liquid. It's for a cough. 100 milligrams per 5 milliliters. So we're going to check our doctor's orders, and we're going to check the patient's allergies, and we're going to perform hand hygiene, and then we're going to go and get our medicine. We're going to make our calculation, which I've already done, 150 milligrams over 1. Then you have 5 milliliters in 100 milligrams, or 100 milligrams in 5 milliliters, and then you multiply the top numbers, 750, multiply the bottom numbers, 100, and then you divide that, and you get 7.5 milliliters, and that's how many that we're going to be given today. So we get our medication in check before we do our calculation. That's one time we have to check our medicines 3 different times. Then we're going to check our medicine right before we actually pour it up. And so here's our cup, and then our medication. We're going to make sure to put the label in the palm of our hand. We'll pour with my dominant hand. Open this. Make sure we pour it on a level. We're going to be pouring 7.5 milligrams. Okay. All right. So And also make sure that we always put the cap right side up, even with tablets. So we've got our medication. We're going to check our medication again to make sure that it's what the doctor's ordered and according to the MAR, like I explained that earlier. So then we're going to gather all of our supplies. We're going to gather all of our supplies. We're going to go into the patient's room and we're going to state, or we're going to ask the patient to state their name and date of birth. We're going to check their armband. That's our 3 ways of identifying the patient. We're going to set the patient in high Fowlers. Before we do that, we're going to perform hand hygiene and put on our gloves. Then we'll set the patient in high Fowlers. And then we will check our medication again right before we give it the 3rd time. Have to check it 3 times. We'll check our medicine 1 more time. And then we will administer the medicine. And then we will position the patient back to comfort. We will document that we'll initial the time and the date we've given. We know that this is safe because this is their first, we're going to give it PRN as needed. This is their first dose of this medication, and it's a safe dosage for them, and it's a safe time to give it. So then we're going to document that, initial it, and we'll be done.